Hello, welcome to CRPS, A Patient's Perspective. This is episode 4 in the interview series I've been doing. In this video I'll be just interviewing the one person, Joe, and Joe has had CRPS now for 33 years, and this is her story.
Now, I was a nurse when I got injured at work back in 1984. It's 33 years ago. First of all, I'd never heard of RSD.
No.
Nobody told us about it in nursing school. My doctors didn't know. And when they said there was no cure, I found that almost impossible to believe.
Yeah.
So how can you have something that's that painful that nobody can help? And after 30 years, sadly, I believe it. And now my son has it.
Oh, really?
So
Oh.
I read up on it several times, and they said, yeah, there is a familial predisposition, a possibility that someone in the family may contract it if the right circumstances arise. And he had surgery for triceps avulsion, and that was about 2005 in his dominant arm. And he's had an awful time getting treatment.
Yeah, okay.
I feel bad because I almost feel like it's my fault. It's
No,
not.
I know what
But
you
I
mean.
do.
I know what you mean. Yeah. There has been some cases where they found it is in the family, you know. It's only a small percentage, but I think it's too much to be coincidence. You know what I mean? But
Yeah.
only just. It's not a large amount. It's only 5% or 7% or something like that. It's a very small amount that's
Yeah,
in the
very small.
family. But it's too much just to be coincidence, I think. Yeah. It's
Yeah,
unfortunate.
there's something genetic in there.
Yeah, I mean, I got 4 kids, and I don't want any of them having it. You know, I
Oh God, no.
don't wish it on any of them. You know, so
Um,
It's not fun, I'll
it's
guarantee you that.
it's hard on the family.
yeah,
My husband, bless his heart, we've been married 50 years, and of course he's been through every step of this with me. And when I have a really bad flare up, he says, you know, I feel helpless.
yeah,
I can see that you're in pain, and I can't do anything for you. I can't massage your shoulder. I can't give you anything. I can't put a heating pad on to make you feel better.
yep, yep.
And I feel bad for him because he has to
Yes,
watch
yeah,
this and feel helpless.
yes, yep,
So it
yeah,
affects everyone.
yeah,
You know, when I talk to people about RSD, I want to make sure, you know, that we're on the same page. I've talked
yep,
to other people who have said they've had it, and what they actually have is fibromyalgia, and
yep.
Lyrica helps for them, and some other things. Some people have said, "Oh, acupuncture works great." If anyone got near my arm with a needle, I'd probably throttle them.
Yes,
But yeah, I just want to make sure, you know.
yeah. No,
I'll tell you,
I'm
this is,
going on. I'm nearly 12 years now. I've had mine, so yeah, in my right dominant arm as well. So
uh,
yeah, mm,
it makes it harder. It really
yeah,
does.
mm, mm,
Now, I did have a support group at one time. We just moved to North Carolina 2 years ago to be near my son and warmer weather. We thought the cold weather up in New York was too much on the arm, so I thought it'd be better down here. Unfortunately, it hasn't been, and it took me almost 7 months to get someone to treat me down here. I have an implanted morphine pump, which
okay,
right now is just, it's a pound of metal sitting in my body that does nothing. It was
yeah,
working great. I had what they call rescue meds. So I had oral pain meds. So when I had a flare up, a breakthrough, it brought it back down. Because to
yeah,
change the pump dosage, you have to go to the hospital, go through the whole rigmarole, They changed the pump. And 2 days later, the pain's changed, so we'd have to change the pump again. And we
Yeah.
can't keep doing that. So the
Yeah.
oral meds were rescue meds. They just as needed.
Yeah.
And they're not high dose. And after 33 years, believe me, if I were addicted to the pain meds, I would know it. The only one I'm addicted to, or was, is the morphine, because I can't control it, and it goes right into the spine. It's an intrathecal catheter.
Yeah.
Uh,
It's
So
more
we were
dependence
doing great.
than an addiction, though. You know, if you were offered another medication that you know was maybe you know we're told was stronger than morphine and better than morphine, you would soon want to stop the morphine and take the other one. You know what I mean? The new
Yeah, if
option.
something
You
else
know,
worked better.
yeah. And that's where people that are really addicted to a medication like that won't change medication. They'll take something else as well, but they won't give up the one that they're addicted to. I see that as different from dependence, you know.
Yeah.
I take morphine tablets as well, you know. They're slow release ones.
Uh-huh.
Yeah, but
Yep.
same thing. I'd stop them if I feel. I mean, they only help that 15% sort of, you know what I mean? And I've had to keep going
Yes.
up in strength, and now they don't feel like they work much at all, you know. And I've just stopped so many other
Oh, yeah.
pills and medications they've just given up on. Mm,
If you're like me, and most people that have had this, they throw everything at you.
yeah.
My first year, I had medications that I'd never heard of,
Mm,
even though I'd studied them for years. And nothing seemed to help. Initially, we just dealt with medication, then they did a nerve conduction study. I don't know if you've had one of those done.
no.
Um, they insert um, large needles into the muscle and then
Oh,
hit it with electrical impulses to see
okay.
the nerve transmission. So you can imagine somebody sticking a needle into your right arm
No, thank
and
you.
hitting it with high voltage. For 2 days, I couldn't move.
No.
The pain was absolutely through the roof.
Yeah.
So they said, "Oh well, gee, yeah, you do have a problem." I said, "Well, thank you." Down to Syracuse. It was a 3-hour drive, but it was worth it. They had just opened a pain clinic. They did a thermograph because my arms turn white and bluish
Yes.
white and get ice cold.
Yep.
They did the thermograph, said, "Oh, you've got RSD," to which I said, "Okay, what is it?" They explained it to me. That's when I learned I'd have this for the rest of my life.
Yeah.
We did nerve blocks. I did 3 trials of nerve blocks, 7 blocks each. After a year, they pretty much gave up on those. Then they came up with a cervical sympathectomy. Your pain is in the arm like mine. Stellate ganglion right here under
Yep.
your collarbone.
Yes. Yep.
Okay, that nerve bundle mediates the sympathetic system to your left arm, or whatever
Yep.
arm it is. They remove it. They said
Oh,
you'll have a
okay.
Horner syndrome.
They don't
So
block it.
the
They
Horner syndrome,
remove it.
your eyebrow droops, so you kind of look like you're drunk on one side,
Yeah.
and you lose the ability to sweat or perspire on the upper body on that side.
Okay.
And they said you only get maybe 40% relief. At that point, I said I'd kill for 5%.
Yeah.
I was that bad,
Yeah.
and I know how you probably know how that feels. They did the surgery. The Horner syndrome wasn't bad, and when I went home, my husband laughed at me. You know, all the way home in the car, I was rubbing a feather up and down my arm because I couldn't feel the pain.
Yeah. Yeah.
It did the job. So I thought,
Yeah.
okay, great, this is done.
Okay.
And he was happy too because at night I used to nudge him and tell him, turn over, you're breathing on my arm.
Yeah.
Because just
Yeah.
the breath hurts, right?
Yeah. I put the blanket between my own breath and my arm as well because I can't even. Yeah. It's just too irritating. and it will just turn to pain if I
Yes.
keep doing it. Yep. Mm,
Yep. So you know exactly what I'm talking about.
yeah.
So I was able to go back to work, and I was just thrilled.
Yep.
But I didn't realize, and they didn't at the time. Sympathectomies only last 18 to 24 months tops.
Okay.
The nerve fibers eventually regenerate. It takes a long time. It's only like, oh, a quarter of an inch a year, something like that. That a nerve,
Right.
they regenerate very slowly.
Wow.
And after a year and a half, the symptoms came back, but because they went between my ribs to go get the ganglion,
Yeah.
the RSD had spread to my ribs and to my shoulder instead of just
Oh.
the elbow and lower arm.
Yeah. Yep.
So I had it spread, and it got worse. There was nothing that could touch it.
Yeah.
We went back to all the medications. Nothing worked. More treatments. Finally, they said, we can give you a pump. We did trials, and the last trial worked. I got maybe 50% relief. I said, great, I'll take it.
Yeah.
It's better than nothing.
Yeah.
But because I had the pump, I couldn't work anymore as a nurse. You've got
Yeah.
narcotics in your system, you can't
Yeah.
work on the floor.
Okay.
So after all the time I spent being a secretary and going to nursing school because that's what I really wanted, I had to give it up. You know, what life changes so much with RSD. I formed a support group. We made little plans. You know, if you went somewhere with my family, it was like watching the president with the Secret Service around him.
Yeah.
They'd go around, walk around me so people couldn't bump my arm.
Yes.
But
Yeah.
invariably, you walk in a store and somebody will grab your arm and say, "Oh, did you see that?" And
Yep.
they don't realize that they're putting you through the ceiling with the pain.
Yeah.
And how do you explain it? They go, "I'm sorry." Don't be sorry. You didn't know.
Yeah.
But
Yeah.
it's a constant. You're always worried. You're always guarding yourself.
Yes. Yeah.
We did have a doctor that helped with the support group, but he was transferred, and no other doctor wanted to acknowledge it. There's still, after all these years, they still think that they can give you something. They can do therapy. They can give you a magic pill. Lyrica, when it came out, I thought it was great. It worked for 6 months. The dosage kept increasing and increasing and increasing, but little by little it loses its effectiveness.
Yeah. Yep.
My son did the same thing. He took it. He's 50, so it's, you know, I'm not talking about a kid. And he thought it was great, and then he did the same thing. It just keeps losing effectiveness. It
Yeah.
works with certain things like fibromyalgia, but not this monster.
Yeah. Yeah.
The problem with the support group is instead of what I wanted, which was all of us looking for ways to cope with this, it became, excuse my language, bitch session. Everybody wanted to complain about how bad their life was instead of looking for things to improve it.
Yep.
So it eventually fell apart. We didn't have a doctor. We didn't have anyone with a positive attitude. So it fell by the wayside. Instead of being support, it turned into the opposite.
Yeah.
I still get phone calls. There is one physician I talk to that has asked my permission. If someone comes in and gets diagnosed, will you talk to them? And
Okay.
I've given my permission. I get phone calls. I talk to them, try to explain it,
Yep.
and try to give them encouragement, because you know how devastating it is for someone to say, "You got this." It's like saying, "You have cancer.
Yeah.
You've got this cancer pain, but it's not going to go away, and you're not going to die.
Yeah. Yeah.
At
Yep.
least cancer's got an end. This has no end."
Yes. Yeah.
So
And I've heard of
It's
quite
really
a few
hard.
people go into remission, but it's generally temporarily. Even if it goes for a couple of years, quite
Yes.
often comes back. And I've heard of people that are in remission and they only had it for a few years or a year or something. They went into remission, and I won't tell them that it
Hmm.
comes, but it's a good chance of it coming back. But I wonder sometimes, should I be warning them a little bit, and so that they know to have ketamine infusions or something through their next surgery, or you know what I mean? Should the little things that they can maybe
Yes.
do to help um, not get it again, help it, try to reduce it coming back
Right.
anyway. Yeah, you're never going to stop it, you know.
Well, that's yeah. It's
Did you tell him how
I can,
young you guys had it?
yeah. It's you don't want to be discouraging to them if they do go into remission, but at the same time, you don't want them to think, okay, this is it forever. I'm going to be good.
Yeah, it's
They
safe.
have to know there is a possibility
Yeah,
that it could come back and get them, so they're prepared and they're careful. Don't re-injure the limb. Watch what you're doing. Watch what you eat. Watch what you do.
yeah,
Um, yeah, if you have something that's harmful, you don't want to do it again, so you have the same problem.
no,
You
no,
want to try and avoid this thing.
yeah,
I just can't imagine anything else. I mean, I've seen a lot of people, obviously through my work and all, that have had terrible conditions. But a lot of them, I've even said I'll trade places. They're in wheelchair or whatever. I would do it
hmm,
if I didn't
yep,
have to go through the pain every day.
yep,
I can
yeah,
handle a wheelchair, crutches, whatever. But it's the constant pain and never knowing when you get up. The weather changes. With me, it's the barometer.
yep,
I
yep,
have a very narrow section. I got my barometer marked with a little marker.
yes,
I know when it gets in that range, I'm going to have a bad day, and I do, without doubt.
yeah, yep, yeah,
So it's either
absolutely.
I hope it's really bad and it's going to rain, or it's going to be cold. But if it goes into a really fair day, everybody says it's a beautiful day, the sun is out, and I cringe because I know that's a day I'm going to be curled up on the couch, biting my nails, hoping it's going to go the other way.
Yeah,
Um,
yeah,
Everybody has a different trigger, different different circumstances that it gets worse or better. But the whole point is it never goes away.
no,
And
no,
I don't know if you get commercials down there for Lyrica like we do here. Um, every time I look at them, I want to cringe. This woman comes on and says, when you see me, you see an ordinary person or just like everybody else. But I'm not. I have fibromyalgia. I have chronic widespread pain. And I'm
hmm,
thinking, why doesn't somebody talk about ours?
yeah,
They're not
yeah,
published enough.
no, no, not at all.
Millions of people
There's
have this.
When did you
yes,
ever see a
yeah,
commercial
yeah,
about RSD?
Yeah,
no, not ever,
nobody knows about it.
no, no,
I don't
no,
know what to say. The McGill Pain Scale rates RSD above cancer in pain.
yes, yeah,
I
yeah,
don't know if you've seen that.
yeah, I've seen that, yes,
Yep. And I just met someone a year ago. We were talking a few weeks ago, and she said something about her daughter having a chronic pain syndrome, and she has fibromyalgia. And I said, okay,
yeah,
well, imagine it going a step further, being worse, and having
yeah,
nothing to stop it.
yeah,
But that's another thing. My pets keep me grounded.
hmm,
I find if one of them curls up in the chair with me, and I can pet them with my right hand, I kind of calm down, and they all
yeah,
know don't touch my left hand because
yes,
it's just
yeah. They're very
they can
intuitive like
sense.
that. Yep, yep. They are
Yeah,
very intuitive when it comes to a damaged limb or something like that. Yep, I found the same thing. Yeah, yeah.
it's too bad people aren't like that, huh?
No, no.
Too bad
You're
people
right
can't
there.
sense it.
Yeah,
Yeah.
absolutely. Yeah, but it makes you be
Um,
wary of other people and their conditions as well when you go out yourself because you're like this,
Yes.
and you look at somebody else who might be shuffling or struggling, and you know not to touch them, give them a wide bit of room, because you don't know what condition they're really in, you know.
That's true.
Mm.
You're right. You do. You become more sensitive to somebody else. And when they
Yes.
become, well, my daughter, I know she was the hardest one to convince that this existed.
Mm-hmm.
She's married to a chiropractor, and he read up on it, so he understands it and tries to explain it to her. A few years ago, she got her foot caught between the boat and the dock,
Right.
and really injured it bad.
Yeah.
And his concern was that she fell off the RSD as well. And it took him quite a while to convince her that it was possible. And she saw a neurosurgeon for possible nerve damage, and he also confirmed it. So now she understands it more, but it's a shame that it took an injury for her to understand her own mother's pain.
Yeah.
And that happens with
Yeah.
so many people on the website.
But I see that's one of the biggest problems is getting family members and friends to understand. To listen to you. I don't want them to cry with me. I don't want them to sit there and say, "Oh, gee, that's you poor thing." I just want them to understand.
Yeah.
Just understand, and just be there if I need you.
Yes. Yeah. 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 Some people just don't get it. Some people, for some reason, they can't comprehend it, which is strange, especially when your own parent or your partner or your child or something is telling you about it, and you still don't believe them. That it.
Yes.
Yeah. It's how can you not believe me? It's like.
It's hard. It really is. It's difficult.
Yeah. And I've never met a single person who knew about CRPS or RSD before getting it.
No.
Nobody. You know what I mean?
Yep.
Everybody's always clueless. At the time. Yeah. Absolutely.
I like you. I just pray that nobody in anyone's family winds up getting it. That's what's scary is like you with your children and my two. I've already had one fall to it. I don't want anybody else to get it.
Yeah. No. No. Absolutely. Yeah. So, what was the injury that caused your RSD?
Absolutely ridiculous. I got struck on the elbow with a metal patient chart.
Okay.
Yeah.
Yeah.
Two girls were clowning around at the desk. We were checking orders, and one of them just turned her head away from me and slammed it down. She got on the desk, but it got my elbow right between the bones, right on the nerve.
Yeah.
And by the time my shift ended, I couldn't even open a pill capsule, a pill box.
Yeah.
I couldn't grasp it with my hand.
Yeah.
And that set it off.
Yeah. Okay. Wow.
Just a freak accident.
Yeah. Doesn't take much sometimes, Yeah. Yeah. Yeah.
That's the problem.
Yeah.
It just
No, I
doesn't
mean,
take
you always think it's
I'm
going to be
sorry.
something like a serious injury that it always does it. There's a lady I interviewed, her thumb, she hit her thumb or stubbed her thumb or something, and she ended up getting CRPS in her hand and her thumb and that from it. And it's just such a minor injury,
Yes.
Yeah. Yeah.
You never think something like that would cause something like this. But we don't know how our nerves work. That's the problem. We don't know how that system transmits trauma or infection, that can cause it. I mean, simple things.
Yeah.
You know, it's a hellacious disease. There's no two ways around it. I just don't know how we need to get the word out to the medical community. We have to make
Yes.
them
Yep. Yep.
speak to it.
Mm.
I don't know how to do it.
No.
We're
No.
trying, but
Yeah, yeah, there's many people that try, but no, you're exactly right. Is the not only is it hard enough to get diagnosed, but even when you do, the doctor who diagnoses you still doesn't know enough about it to give you a full rundown. You know what I mean? And really
no.
explain it to you, because there's so much more than just the pain as well, you know.
Oh God,
You
yes.
know, and you know, I mean, the pain's the worst part and the main part, you know, but there's just so many
Yeah.
other little things that, you know, yeah, yeah. And I think the first thing that you should be going to do is you know, treatment with you know, psychiatric treatment and stuff like that, and seeing a therapist, and
Hmm.
you know, there should be a guide, some kind of guide. I mean, I know there's no real treatment and there's no real cure,
Uh-huh.
but there should at least be some kind of guide of what to try and do and how to help the person from the start. From the start, you know.
Yes.
Instead of, you know, 5 years later or 6 years later, then finding a good
Right.
therapist that you can talk to and they come up with new treatments. And it's kind of sometimes too late as well. You know, it's best to get to it early if you're going to, you know. Mm,
It has to be the onset, and it should be a multidisciplinary approach, psychological as well as physical.
yeah,
The
yeah.
dealing with it is sometimes harder than the pain itself.
Mm,
You're having a loved one say, "You look fine. There's nothing wrong with you," and that hurts a lot because
yeah.
they don't know. They can't live in your skin. They have no idea.
Mm, yeah.
I've got an interesting situation here because, as I said, we just moved down to North Carolina. It's not working out well because we just bought a house 1 year ago. 3 months after we bought the house and signed the papers, my doctor decided instead of refilling your pump, we'd want to shut it down now.
Wow.
And I said, "Oh, wait a minute. What are you going to replace it with?" So, "Well, we'll figure something out." I said, "But I don't want to go into withdrawal again." Because I did
Yeah,
once. They
yeah,
made a mistake on my prescription. That's something I
yeah.
never want to go through again. She said, "Oh, you're not going to go into withdrawal." So I saw my other pain specialist. He said, "Nope. The Center for Disease Control gave us guidelines now because of I'm sure you've heard of it down there, our opioid epidemic." That's what
Yes,
they're
yeah.
calling it because they've had so many overdoses. Most of them are for heroin, but
Yes.
we're lumped into it too.
Yeah.
And so I said, "Okay, well, if we shut down the pump, we have to do it gradually in stages." I called the company that makes the pump. They said, "Yes, you have to do it in stages."
Yeah.
They wouldn't do it that way. So they just said, "Nope, we're not going to refill it," and just put me down oral pain meds and drop the dosage on those.
Wow.
So not only was I not getting the same amount, I didn't have the pump, and it takes a while for that little bit of morphine in the liquid to get through your spine and empty the pump out.
Yeah.
So 6 days after the alarm went off, saying that the pump was going dry, I went into withdrawal.
Wow.
So there was a trip to the emergency room.
Oh,
The cold sweats, the nerves jumping, the whole 9 yards.
yeah.
It takes a while to get over it,
Yeah.
but I did. And by the time I got back to the doctor to explain what had happened to it, so they could shut the pump down, because it was alarming every hour on the hour. The pump was ruined.
Wow. Wow.
So now, yeah, my insurance company has paid for a $70,000 pump that sits in my stomach doing nothing.
Wow.
That's
And
that's
so-
what it costs to have one.
And so they've just left it there and they're not going to remove it, or?
They were supposed to, and they have never called me to do it. So I'm going to wait till I go back to New York, talk to the doctor that implanted it in the first place, and see if they'll take care of it.
Yeah.
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 Metal detectors love me. I can't go anywhere near one. Beep, you know.
Yeah.
It's
Wow.
something else.
Yeah.
Yeah, it's it makes life very interesting. It's frustrating. It really is, and that's
Yeah.
just putting it mildly.
Yeah.
But this
Well,
is
I
what
mean,
we're seeing.
33 years. That's a long time. It's probably one of the longest I can think of that I've met from other patients. You know what I mean? I don't think I met anybody who's said much longer than that for a time. I'm sure they're out there, you know. But
Oh yeah, there's gotta be.
yeah, yep. And so, I mean, and in that time, you haven't seen any radical changes in treatment or awareness or anything. And wow,
No.
Wow.
That's what's ridiculous.
yeah,
Yes.
yep.
By now, I had thought the word would have spread. The Reflex Sympathetic Dystrophy Association was formed the year I was diagnosed.
Right.
And I had hoped that they would be spreading the word and getting more awareness in the medical
Yeah.
community. New York State even had a what's the word? That's another thing to do. I don't know if it's my age or the RSD. I can't remember things.
The brain
But-
fog, yep.
They passed a proclamation of awareness to the medical community that
Yep.
RSD existed, that the new term was now CRPS type 1,
Yeah.
and that doctors should be aware of it. But that was, my God, that's when I had the support group. And that's like 7 years ago. And they still don't know.
No.
So I don't know
yeah.
whether it's world ignorance or what.
Yeah. I mean, I always thought
Yeah.
that doctors liked the mysterious puzzles and liked to try and solve them things, you know, I mean, not all doctors, I'm sure. Some doctors have put it in the too hard basket. But, you know,
Right.
most doctors like that kind of, I always assumed, like to come across a puzzle and try and solve it like that, a medical puzzle, and something that's different and new and, you know, out of the ordinary. But yeah, nobody seems to want to know anything about it either. Yeah, it is strange. It is strange. Mm.
You know, I think it's not so much that it's a challenge, but the atmosphere today, like I said, the opioid epidemic thing,
Mhm.
people are, I think, and doctors, especially doctors, they're so afraid that the powers that be, our government or whatever they are watching them so closely for what they prescribe and what they do,
Mhm. Mhm.
that something like this, that of necessity, at one point or another, has to include a narcotic
Yeah.
treatment of some sort, that they're afraid of it. They're afraid of their license being pulled because, well, gee, maybe I'm prescribing too much or too high a dose.
Mhm.
So they back away from it instead of taking it head on and really being a patient advocate, which is what they're
Yes.
supposed to do.
Yes. Yeah. Yeah. Supposed to be on our side. Yeah.
Yeah, that's what I'm afraid. That's what I think it is. I did have one doctor tell me I have to transfer. I have to refer you to another pain specialist because I don't have the full credentials to justify giving you these medications, and they're watching closely up here. That was up in northern New York. He was afraid that they would pull his license.
Yeah.
So, he was honest,
Yeah.
but it's kind of scary when you confront the doctor into not treating somebody because you're threatening their license.
Yeah.
What is that?
Yeah. Yep. That's a bit mixed up as well, isn't it? Yeah.
Yeah. First rule of medicine: do no harm.
No,
And
that's
yet,
right. Yeah.
what are they doing? Yeah.
Yep. Yep. Yeah.
It's
Yeah. You're right. There
frustrating.
should be. Yeah. Yeah. Yep. I'm surprised they don't have their own union or something like that, and start banding together. But they're up against the pharmaceutical companies as well. They're too big and too powerful.
Oh,
You know.
yes, they are.
Yeah. They say something about it. It won't be long until they own 10% of the world market or something like that. That they're just they are just too big and powerful.
You're right.
Mm.
Yeah, there's too much politics instead of the caring end of medicine.
Yep.
Our American Medical Association, the AMA, they're in on it too. So they should be, again, on the side of the patient, but they're not. They're worried about the political end.
Yeah.
So we've got all of this against us. We have to. I don't know how we're going to do it, but I always say we need somebody who is a prominent figure to have RSD and speak on it, so people are more aware. They listen to somebody who's in the public eye.
Yeah.
An actor, a politician, somebody that everybody knows, a sports figure. That would work.
Yeah.
That might work.
Yeah.
But we don't have any yet.
No. I mean, there's a couple that have come out, and I think they've got fibro. Is it Paula Abdul or something, and Pink, and Paula Abdul or something? I think they have fibro though. If they had CRPS, I couldn't see them being up on stage for as long as they are and doing some of what they do. So it has to be fibro or something close to it, but not quite CRPS.
I agree.
Yeah, most of us don't get off the couch or off the bed, so yeah.
Yeah, I thought the same thing when she came up with that, and I thought, finally somebody to listen to. And I listened to her and said, nope, that's not what you got.
No.
Not that I want somebody to get it, but
No.
somebody has to have.
Yeah. Yeah, no, it'd be good to have that public face that, like you say, it makes a difference.
Yeah.
Yeah.
It does. Maybe someday, I don't know.
Well, that's why I'm trying to make this website and get these interviews going, just in awareness. If we get enough stories out there, and maybe people realize, look, there is a lot of people that are truly suffering. Hopefully someone will do something about it.
Well, you're doing a great job. I'm so glad I found your website. I started looking for people. Well, originally I was looking for people stateside who had CRPS that wanted to go along with me, and contacting our governmental agencies who were threatening our doctors and frightening them and stopping our treatments. And I just kind of stumbled across your website in the middle of it. And I thought, wow, somebody's really doing something. And this is what we need.
Yeah.
You're right. You're doing a great
Yeah.
job.
Feel free to use the Facebook page to connect with people in your area and try get that project going. If you need help with it, I'm in Australia, but I'll help with anybody doing anything to help CRPS. Whatever I can do
Great.
from here. But you feel free to use the Facebook page and try and connect with people in your area and tell them what you want to do, and see if you can get a few people to back you up. Absolutely. Yeah.
I appreciate it. Yeah.
Yeah. You might even get some comments off the video as well. Just people listening and watching the video out there. Yeah.
Yeah. I think if we do get some more, as I said, on that, what we get here in the States can transfer to other countries as well. It can go to
Yeah.
Australia
Yeah.
and let your
Yep.
people know, the doctors aren't doing their job
Yeah.
and why.
Yeah. Yeah. Just got to start somewhere though.
Sounds excellent.
Yeah. 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 No, that's a
That'd be
good
awesome.
idea. Yep. Yep. Let's see
Let's
what we can
go-
do about that.
Gotta start working on it. It gives me something to do. At least gives me a purpose.
Yes.
There's nothing worse
Yeah.
than sitting around and sorry.
Yeah, yeah. This is my hobby. This is what I do for a hobby. So, I never had a hobby before I worked. I just used to work all the time, and so it took me a long time to find something to do. And I figured this
Yeah.
will benefit. This is a hobby that also benefits me in the long run. So
Great.
couldn't
Yes,
think of
it
anything
does.
better. Yeah.
Awesome
Well,
idea.
Yeah. Well, thank you very much for chatting with us.
Glad to do it.
Yeah. Have you got anything else that you want to say or finish off with?
The only thing I can tell everybody is it's hard. It's not easy to live with this, but you can do it. I didn't think I could. I almost gave up last year when the pump quit and they dropped my other meds. I didn't think I could handle it. I seriously thought one day driving down the road, I could just turn the wheel and end it all.
Mm-hmm.
And then I thought of my family, my kids, my grandkids. And no, I'm more of a fighter than that. And everybody else can do
good.
too.
Yes.
And we have to do it.
Yeah. Well, 33 years shows that others can do it as well. It's you're an
You
inspiration.
can, you can make it.
You certainly are. Okay, thank you very much. I really appreciate it.
Thank you, Fred, and have a great day. I hope you get some
Will
sleep.
do.
It's late there, isn't it?
Yes,
Yeah.
it is.
Okay.
No worries.
Right.
Okay then. Bye then.
Okay.
See ya.
Bye now.